The big thing, obviously in Canada, and it's across the spectrum of the general population, is really take it outside this conversation about medical marijuana. It's about the opiate crisis. I think roughly 4,000 people a year are dying in Canada through the opiate crisis. 80% of those are thought to have become addicted to these drugs through medical prescriptions, i.e. after accidents, after surgery, after visiting their doctor. And so this is a medically enshrined issue. The reason why I got into prescribing medical marijuana was really because of harm reduction. If I can take someone who's on chronic opioids for a long term and I can transition them away from that to medical marijuana, that's what I'm going to do. I know that they're not going to overdose or cause themselves any ongoing harm. And we've had quite a lot of success doing that. And it's also something that the general population are quite in tune to do. I mean, even older patients don't have the stigma and are much more likely to be open to the conversation of coming away from certain drugs and trying this at the very least. You know, I've been in medicine 20 years. We've all prescribed opiates, and we've all seen people become addicted and get into that awful downward spiral where they need escalating doses of that drug. And we've all had to have very hard conversations with them about, you know, this isn't working for you, we need to bring you away from that. And what's great about medical marijuana is that a lot of these people, okay, are very open to trying and switching over. Okay? It's a very hard conversation to have with someone that you've prescribed an opiate for 2 or 3 years previously, seen them using increasingly escalating doses, and now addicted. You never use the term you're addicted, but everyone knows that that's really what's going on, including the patient. And it's there's very few people that I've prescribed medical marijuana for that have not done well. I have prescribed medical cannabis to more than 100 patients and continue to do so. Obviously, I have a criteria that those patients must fit, but it's something that I'm quite happy to do on an ongoing basis.